Berlin, a city pulsating with life, culture, and history, faces a growing crisis: drug addiction. The escalating rates of drug use and abuse cast a shadow over the city's vibrant tapestry. From the bustling streets of Kreuzberg to the tranquil parks of Prenzlauer Berg, the grip of addiction tightens its hold, impacting individuals, families, and communities. This essay delves into Berlin's drug dilemma, exploring its contributing factors, devastating consequences, and the ongoing efforts to combat this complex issue. The problem is not new. Berlin has grappled with drug use for decades. However, recent years have witnessed a worrying surge in addiction rates, demanding urgent attention. The city's reputation as a hub for nightlife and its relatively liberal drug policies, while attracting tourists and fostering a sense of freedom, have also contributed to the accessibility and normalization of drug use. The consequences of this growing crisis are far-reaching. Drug-related deaths have been steadily increasing, painting a grim picture of the situation's severity. The healthcare system grapples with the influx of patients requiring addiction treatment and support, stretching resources thin. Beyond the statistics, however, lie the human stories: lives shattered, families torn apart, and a community struggling to cope with the pervasive impact of addiction. Addressing Berlin's drug dilemma requires a multifaceted approach that tackles the root causes, provides accessible and effective treatment options, and fosters a supportive environment for recovery. It is a collective responsibility that demands the commitment of policymakers, healthcare professionals, law enforcement agencies, and, most importantly, the community itself. Understanding Berlin's drug crisis necessitates delving into the complex interplay of social, economic, and psychological factors that contribute to addiction. While individual experiences vary, certain underlying issues create fertile ground for drug abuse to take root. One significant factor is the city's stark socio-economic disparities. Areas with high unemployment, poverty, and limited access to education and job opportunities often experience a higher prevalence of drug use. Social isolation, lack of prospects, and feelings of hopelessness can drive individuals to seek solace in substances, perpetuating a vicious cycle of addiction. Furthermore, Berlin's vibrant nightlife and club culture, while an integral part of its identity, can also contribute to the problem. The easy availability of drugs in these settings, coupled with the normalization of recreational drug use, can blur the lines between experimentation and addiction, particularly among young adults. Mental health issues also play a significant role in fueling drug abuse. Trauma, abuse, depression, anxiety, and other mental health conditions can increase an individual's vulnerability to addiction. Self-medication with drugs to cope with emotional pain or psychological distress is a common pathway to dependence. Addressing these underlying issues is crucial in tackling Berlin's drug problem. Creating a more equitable society, providing economic opportunities, improving access to mental health services, and promoting healthy coping mechanisms are essential steps in preventing addiction and fostering a healthier community. The drugs that plague Berlin's streets are as diverse as the city itself. Each substance carries its own set of risks, side effects, and long-term consequences, contributing to the complex tapestry of addiction in the capital. Crystal methamphetamine, known colloquially as crystal meth or simply crystal, has emerged as a particularly potent threat. This highly addictive stimulant produces intense euphoria and increased energy, but comes at a heavy cost. Long-term use can lead to severe health problems, including psychosis, cardiovascular damage, and tooth decay. Heroin, an opioid drug, also casts a long shadow over Berlin. Its potent effects, including pain relief and a sense of well-being, can quickly lead to dependence. Heroin use is often associated with risky injection practices, increasing the risk of HIV and hepatitis C transmission. Cannabis, while widely perceived as less harmful than other drugs, is not without its risks. Regular use, particularly of high-potency strains, can lead to dependence, cognitive impairment, and mental health issues in susceptible individuals. The impact of these substances extends far beyond the individual user. Families bear the brunt of addiction's emotional and financial burdens. Communities grapple with increased crime rates and a sense of insecurity. The healthcare system faces mounting pressure to provide adequate treatment and support services. Addressing Berlin's drug dilemma requires acknowledging the unique challenges posed by each substance and tailoring interventions accordingly. Section 4. A city held hostage. The ripple effects of drug abuse. The consequences of Berlin's escalating drug problem extend far beyond the individual user, casting a long shadow over the city's social fabric, healthcare system, and economy. Like ripples spreading outward from a stone cast into water, the impact of drug abuse touches every aspect of life in the capital. Families are often the first casualties in the war against addiction. The emotional toll on loved ones forced to witness a family member succumb to drug dependence is immeasurable. Relationships become strained, communication breaks down, and trust erodes under the weight of addiction's grip. Children growing up in homes affected by drug abuse are particularly vulnerable, facing an increased risk of developing emotional, behavioral, and academic problems. The healthcare system struggles to keep pace with the growing demand for addiction treatment and support services. Emergency rooms are inundated with patients experiencing overdoses or suffering from drug-related health complications. Hospitals face bed shortages and staff burnout as they grapple with the complex needs of individuals battling addiction. The economic burden of drug abuse is substantial. Lost productivity, healthcare costs, and law enforcement efforts drain resources that could be better allocated elsewhere. Furthermore, drug-related crime, including theft, robbery, and drug dealing, creates an atmosphere of fear and insecurity, eroding the social fabric of communities. Addressing Berlin's drug crisis requires a collective effort to mitigate these ripple effects, providing comprehensive support for families affected by addiction, strengthening the healthcare system's capacity to address the needs of individuals seeking treatment, and investing in crime prevention and social programs are essential steps in tackling the multifaceted challenges posed by drug abuse. Section 5. Combating the crisis initiatives and interventions. In the face of this growing crisis, Berlin is not standing idly by. A multitude of initiatives and interventions, spearheaded by local authorities, law enforcement agencies, and non-profit organizations, are working tirelessly to combat drug abuse and its devastating consequences. One of the cornerstones of Berlin's harm reduction strategy is the operation of safe injection sites, known as drug consumption rooms. These controversial, yet undeniably impactful facilities provide a safe and hygienic environment for individuals to consume drugs under the supervision of trained professionals. By providing clean needles, naloxone, an overdose reversal drug, and access to medical care, these sites aim to reduce the risk of overdose deaths, HIV and hepatitis C transmission, and public drug use. Alongside harm reduction measures, Berlin recognizes the importance of prevention and treatment. Public awareness campaigns educate young people about the risks of drug use, while schools and community centers offer drug prevention programs tailored to different age groups. For those already struggling with addiction, a range of treatment options is available, including detoxification programs, outpatient counseling, residential rehabilitation centers, and medication-assisted treatment. Law enforcement agencies play a crucial role in disrupting drug trafficking networks and reducing the supply of drugs on the streets. However, there is a growing recognition that simply arresting and incarcerating individuals struggling with addiction is not the solution. Consequently, Berlin is increasingly adopting a more compassionate approach, focusing on diverting individuals with substance use disorders away from the criminal justice system and towards treatment and support services. Section 6. Real Lives, Real Stories, the Human Cost of Addiction. Behind the statistics and policy debates lie the deeply personal stories of individuals whose lives have been touched by addiction. These real-life experiences paint a poignant picture of the human cost of Berlin's drug crisis, reminding us that behind every case file and medical record is a human being deserving of compassion and support. Take, for example, the story of Sarah, a bright and artistic young woman from Prenzlauer Berg. What began as experimentation with ecstasy at a club quickly spiraled into a full-blown addiction that consumed her life. Her once promising future as a graphic designer faded into the background as her life revolved around obtaining and using drugs. Sarah's story is not unique. It is a tragically common narrative in a city grappling with the seductive allure and devastating consequences of drug abuse. Then there's Stefan, a middle-aged construction worker from Mazan whose descent into opioid addiction began with a workplace injury. Prescribed painkillers for his chronic back pain, Stefan soon found himself dependent on the opioids, his life spiraling into a cycle of addiction, job loss, and social isolation. His story highlights the often overlooked pathway to addiction through prescription medications and the urgent need for responsible prescribing practices and effective pain management alternatives. These stories, while just a glimpse into the vast human landscape of addiction in Berlin, underscore the urgent need for a compassionate and multifaceted approach to addressing this complex issue. It is through understanding and empathizing with the individual experiences of those affected by drug abuse that we can begin to dismantle the stigma surrounding addiction and create a more supportive environment for recovery.